Osteoarthritis is the most common form of arthritis affecting millions of people worldwide. It occurs when the protective cartilage that cushions the end of the bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips, and spine. The exact cause is not known, but several things are thought to increase your risk of developing osteoarthritis, including joint injury and overusing your joint when it's not had enough time to heal after an injury or an operation. In the US, serrapeptase is classified as a dietary supplement. Serrapeptase is used for painful conditions, including back pain, osteoarthritis, rheumatoid arthritis, osteoporosis, fibromyalgia, carpal tunnel syndrome, migraine headache, and tension headache. The usual adult dose of serrapeptase is 10 mg 3 times per day, 2 hours after meals. Serrapeptase has to be taken for 1 to 2 weeks as an anti-inflammatory agent for benefits to be noticed. Vitamin D intake is inversely associated with cartilage degeneration among patients with osteoarthritis, and supplementation may have a protective effect. This is suggested by an analysis of data from the Osteoarthritis Initiative. You can get a 25-hydroxy vitamin D blood test to determine your levels and then supplement with vitamin D3 accordingly. Vitamin D3 works synergistically with vitamin K2. When calcium is uncontrollably deposited in arterial cartilage, the development of symptoms of osteoarthritis develop over time. Vitamin K2 plays the role of a transporter. It redirects calcium into the bone and prevents its precipitation and the adverse effects on the joints. The maximum amount of K2 that your body can absorb in a day is 300 micrograms. Therefore, greater than this is not needed. There's anti-inflammatory and anti-hyperalgesic effects of taking vitamin B1 during CFA-induced arthritis. Magnesium is widely involved in human physiological processes like inflammation that play key roles in the generation and the progression of the disease. Magnesium deficiency is considered to be a major risk factor for osteoarthritis development and progression. The best form would be to take magnesium bisglycinate. To determine your dose, slowly increase until stomach discomfort or diarrhea is noticed. Then reduce slowly until you've determined your maximum tolerable amount of magnesium. Magnesium is required by hundreds of enzymes in your body, so daily supplementation can have profound benefits over time. Glucosamine sulfate might provide some pain relief for people with osteoarthritis. The supplement appears to be safe and it might be helpful for people who can't take non-steroidal anti-inflammatory drugs. A 6-month trial on chondroitin in 162 patients with severe osteoarthritis of the hand showed that it also may improve pain and function. One study of 45 patients with osteoarthritis of the jaw showed that those who were given glucosamine had less pain than those who were given ibuprofen. Deer velvet has been used to reduce muscle aches and pains, to improve the way that the immune system works, and to decrease inflammation. Deer velvet has also been used in people with osteoarthritis to reduce joint pain and to improve function. Lab and animal studies have shown that pilose, a protein found in the antler velvet, has anti-inflammatory effect. Antler velvet is also rich in chondroitin sulfate, collagen, and glucosamine sulfate. The properties and the makeup of the compound could make it useful as a treatment in a variety of types of arthritis. Dosing can start at 500 mg per day of deer velvet. Some lab and animal studies have found that vitamin E may help to treat osteoarthritis by stimulating the growth of cartilage cells. Other studies have found that it has some anti-inflammatory properties. Make sure to take a mixed tocopherol form of vitamin E. Glutathione is the body's master antioxidant. Based on numerous studies included in the literature review, glutathione and its precursor N-acetylcysteine have demonstrated significant protective effects in events of prolonged exacerbated oxidative stress, as is seen in chronic inflammatory musculoskeletal disorders like osteoarthritis. In order to make glutathione, your body needs selenium, so 3 Brazil nuts per day can give you the recommended daily allowance of 200 micrograms of selenium. Some other ways to naturally increase glutathione are supplementing with reduced glutathione at up to 1000 milligrams per day, taking the precursor N-acetylcysteine at 500 milligrams 3 times per day, and using the herb milk thistle. New research has shown for the first time that omega-3 in fish oil could substantially and significantly reduce the signs and the symptoms of osteoarthritis. Typical doses are 3 to 9 grams per day of a molecularly distilled omega-3 EPA-DHA fish oil blend. Type 2 collagen is one of the main proteins in cartilage. It's been suggested that taking collagen hydrolysate can improve the symptoms of osteoarthritis by stimulating your body's production of joint collagen. Typical doses are 5 to 30 grams per day of collagen. Coenzyme Q10 exerts a therapeutic effect on osteoarthritis via pain suppression and cartilage degeneration by inhibiting inflammatory mediators, and this plays a vital role in osteoarthritis pathogenesis. Doses in studies range from 300 to 500 milligrams per day of CoQ10. Alpha-lipoic acid can improve the clinical symptoms of patients with osteoarthritis, and it can reduce the level of inflammation, and this may be associated with the inhibition of various signaling pathways. Doses of alpha-lipoic acid are 600 milligrams taken 2 to 3 times per day. Picogenol is a compound that comes from the bark of European pine trees. Picogenol is a powerful antioxidant shown in nearly 5 decades of research to reduce inflammation in patients who are experiencing osteoarthritis symptoms. Doses can range from 200 to 400 milligrams per day. Studies demonstrate that curcumin is clinically effective as a long-term adjuvant treatment of osteoarthritis. Its poor bioavailability can be enhanced by taking it with bioperin, which is black pepper extract, by frying it with coconut oil, ghee or butter, or consuming it with omega-3 fish oil. Doses can range up to 5 grams per day of curcumin. Available evidence from short-term randomized control trials shows that MSM may have a moderate effect in improving joint pain and swelling, as well as general functional well-being in people with osteoarthritis. In one trial, this effect was greater when the MSM was combined with glucosamine. MSM works synergistically with vitamin C. A handful of studies suggest that vitamin C may prevent cartilage damage that's associated with osteoarthritis. MSM doses can be up to 30 grams per day, but they can cause a detox at first. Vitamin C is best taken as liposomal and non-acidic vitamin C, not cheap acidic ascorbic acid. In theory, ginger can reduce the activity of several chemical substances that promote joint inflammation. Results from randomized control trials assessing its role in treating participants with osteoarthritis found that it has a high safety profile and it can have moderately beneficial effects in reducing pain and disability. Boswellia is also known as Indian frankincense. Studies show that Boswellia may reduce inflammation and it may be useful in treating osteoarthritis and rheumatoid arthritis. Boswellia can be applied externally as well as taken internally. Several studies show that taking devil's claw for 8 to 12 weeks can reduce pain and improve the functioning in people with osteoarthritis. One 4-month study of 122 people with knee and hip osteoarthritis compared devil's claw and a leading European medication for the pain relief. Foods that are associated with increased inflammation should be limited for people who have osteoarthritis. These include sugar, salt, saturated fat and trans fat, refined carbohydrates, omega-6 fatty acids, dairy, alcohol, and MSG. For more information about the herbs and supplements mentioned in this video, check out my website.